The West Texas measles outbreak has yet to reach Houston. However, we've learned Methodist Hospital recently sent out an alert warning people they may have been exposed to the virus through one of its patients. Michelle Choi is live in the medical center. Michelle, what are you learning about this?
Well, Marcelino, according to Houston Methodist, this all started after the city's health officials alerted them that one of their patients who had stopped by one of their locations tested positive for measles. Now, this comes shortly after health officials told us about a recent positive case involving an infant.
So, Dr. Purse, how many measles cases do we currently have here in Houston?
So right now here in Houston, we really have none. We recently had a case. That child is recovering, is at home, and is no longer infectious to anybody else.
According to Houston's chief medical officer, Dr. David Purse, the infant got exposed while traveling internationally with family. Dr. Purse says the baby was too young to be vaccinated. It's the third confirmed measles case in the city this year. With the latest measles case, Dr. Purse praised the child's parents and clinicians for helping to slow the spread.
But that was probably the key thing, was bringing the child to get evaluated because the child was sick, doing that early. And number two, the clinicians thinking measles.
This comes as Houston Methodist Hospital was notified that a patient who visited one of their facilities had tested positive. That prompted them to immediately alert people who might have been exposed by phone and letter out of an abundance of caution. Houston Methodist isn't saying which location or confirming if the patient is the infant, but say if you haven't received an alert from them, you're in the clear. As for the baby who recently got sick, Dr. Purse says the parents didn't know the baby had measles. He shared some signs parents can look for.
With measles, you generally get a pretty high fever, bad body aches, a lot of redness and tearing in the eyes. And then on about day 4 is when the rash begins.
He says that rash generally starts on the face and spreads to the rest of the body. And if you do believe your child might be sick, he says the number one thing to do is alert your doctor ahead of time so they can make arrangements.
If you think your child has measles, I would definitely call ahead.
In Houston, Michelle Choi, KHOU 11 News.